you're struggling with elbow pain, there's some common causes for this. We'll go through what tests you can do to help you distinguish what is likely going on, and then we will link a video for each of them which goes into more details of what it is and what you can do to help it. Starting off with the most common is tennis elbow. This is pain mainly pinpointed around the outside of the elbow and is all about that lateral epicondyle, that bony bit on that outer elbow. There are three main tests you can do to see if you have tennis elbow. The first is Cozen's test. Have your arm rested on a surface, make a fist, and then with your other hand resist lifting of the wrist into extension. You'll feel the muscles of the common extensor origin that attach into the lateral epicondyle activate, and if you have tennis elbow, this will be painful or at least feel different compared to the other side. The second is Maudslay's test. This works in the same way, but this time rather than resisting your whole hand, you're resisting middle finger extension. This again will create pain at the elbow if you have tennis elbow. The third is Mills' test. This normally involves a therapist moving your arm, but you can do it yourself by bending your elbow and wrist while pressing on the lateral epicondyle. Then straighten your arm and you'll feel pain at the elbow. If all three of these bring pain, then you can be pretty confident you have tennis elbow. If 0 out of 3 do, you can be pretty confident you don't. Even though you can do all these tests, one of the biggest clues is that you've got pain when you press around the common extensor origin and that lateral epicondyle. Another common elbow issue is golfer's elbow, with pain very commonly onset with gripping activities. Depending where you look, it says this can be 3 to 10 times less likely than tennis elbow. And this instead is all to do with the medial epicondyle, the bony bit on the inside of the elbow. Again, there are 3 things you can do to check for this. The more that are positive, the more confident you can say that you've got golfer's elbow. The first is resisting wrist flexion. Again, you have your forearm rested on a surface, but with the palm face up. Make a fist and use your other hand to resist the movement. This will activate the common flexor tendon and will be a positive if you have pain at that medial epicondyle. A second test you can try is a very similar position with the arm rested, but then you'll move the fist towards the little finger direction, so ulna deviate the wrist. And just doing this movement, you'll see the activation of the muscles on the medial forearm. Resist the movement with the other hand, and a positive is pain at the medial epicondyle again. The third, most simple test is palpating around the medial epicondyle and the common flexor tendon. Pain into this area when pressed would be a positive. A third common issue that can occur at the elbow is cubital tunnel syndrome. This can also bring pain at the medial side of the elbow, but is related to compression of the ulnar nerve and commonly associated with pins and needles into the hand. The first test is a Phelan's test at the elbow. For this, bend your elbow and add some overpressure with the other hand. Hold this for around 30 seconds to a minute, and if it starts recreating symptoms at the elbow or up into the hand, then this would be classed as a positive. Another test you can do for this is pressing at the cubital tunnel. So this is just below that medial epicondyle, and when adding compression, a positive is again reproduction of symptoms with pain at the elbow and or pins and needles into the hand. The third test for cubital tunnel is a Tinel's test at the elbow. Have your elbow slightly flexed, then at the place where you did compression on the last test, you want to take your index and middle finger of the other hand and repeatedly tap at the cubital tunnel. Again, a positive is reproduction of symptoms, and normally with shooting up into the hand. The more positive tests, the more confident you would be with the diagnosis. With cubital tunnel being down to the nerve, it's not as simple as golfer's or tennis elbow, and we will want to rule out other areas as the nerve travels all down the arm from the neck. So sometimes this may be neck related or a thoracic outlet issue instead. So best to get this checked by a professional. We talk about that more in this video here for cubital tunnel, which also has exercises you could do to help. If you have golfer's elbow, then check out this video for exercises, and if you have tennis elbow, then check out this video here. There are other issues that could occur at the elbow that we haven't covered. These are just the more common ones. If you're not positive for any of these, then see a professional for an assessment.